Morning, everybody.
Good morning.
Good morning.
Good morning.
Good morning.
So good morning again and happy Friday. Since it's 8 o'clock, I will go ahead and get us started. So I would like to call to order our last Durham Recovery and Renewal Task Force meeting. It's so hard to believe that we had our very first task force meeting a year ago, and it was actually on May 15th. And it was my first time meeting almost all of you, and what a pleasure it has been getting to know you better and collectively doing some great work in support of our Durham community. So since this is our last meeting, our agenda today focuses primarily on what happens with some of the great work that was started by the task force after today, and really spending some time reflecting over the past year, because there's been a lot of contributions that everyone on this call has contributed to. So we just wanted to pause a moment and reflect on those contributions. So with that said, I will turn it over to Mayor Schul and Chair Howerton for some updates.
Good morning. I don't see Chair Howerton on right now, so I think I'll go ahead and get started. Wow. What a body of work we have done together. Still a long way to go. But when I think about when Wendy and I first made these appointments more than a year ago, who knew what we would go through together and the work we would do together. But especially, I'm just so grateful to all of you all. I mean, what an amazing group of leaders, and everybody has made a different kind of contribution. But altogether, I think of very few things I've done in my life, especially in my public life, that have been more valuable and more significant than the work that we've done together. I'm really, really proud of it. And I know you all are too. I do want to say a special word about our chairs. We have been so fortunate to have Katie and Maticia to lead us. They have been so steady on, so much, taken so much initiative, just structured everything for us so well. And I really want to express my gratitude to you, Katie and Maticia, for doing it. I'll just say that when I first asked Katie to do it, she said no, she really couldn't. It was just too much going on, and she was running a hospital during a pandemic. So I begged, and eventually she agreed, and I just feel so grateful to you, Katie. And Katie was, I think, very much a known quantity in our community as a leader, president of the chamber, and so forth. And not so much for Maticia, but we in the city knew Maticia because of the work she had done, chairing our audit services committee and being on that for so long. And so those of us who knew Maticia knew that she would be that same kind of amazing leader, and she has been. And so much gratitude to you all. And to all of you all who have served. It has just been, it's been a rocking group, just amazing. I don't think I could I just feel the other person I want to single out is Rod. Yes, we have all had a lot to do. We have all had a lot of pressure on us. We have all had a lot of tough decisions to make. We have all had to take a lot of initiative, but nobody has had the pressure on them to do the right thing, to do it well, to execute well like Rod Jenkins. And we know that we have been so well served, Rod, by your leadership. My gratitude is immense. And I know that our whole community feels that way. Unfortunately, your job in this pandemic is not done, but you have brought us through one heck of a time. And I know I express the gratitude of an entire community when I say that to you. All of our, the other special advice I think we've had from Ibukun has been amazing. And I also have to mention Phil Harewood. What Lincoln has done during this time, the way they have had to change the way in which they serve people, the way in which they've had to serve this continually most challenging population, and have done it so well. So grateful, Phil, to you. So grateful to Ibukun for the leadership that you've given us. And I think your calming presence, Ibukun, your ability to deliver a message in a way that we can all hear. And it's been amazing. So I want to turn now just to two things that we do have going on. And the first is, I want to mention three things. One is I wanted to just mention the Workers' Town Hall that CC led a couple of weeks ago. And I know several of you all were on it. I know a bunch of you all listened to it. It was fantastic. And so many good ideas came out of that, which are being codified and are being fed into our system of requests and for funding. And I just really appreciate you, CC, for doing that, for leading that. And I know it's going to yield really good results. We, of course, have the other proposals that are coming forward through Susan's committee and, in terms of employment and bringing our economy back. And those are also super important on our agenda. I now want to talk a little bit about our vaccine equity proposal that the council and the commission have in front of us. This was a proposal that I wrote after meeting with lots of community-based organizations who have community health workers already through the state, meeting with the Gilling School folks, meeting with Rod and Katie, Maticia, Kurt Ribisol from the Gilling School, and Phil Harewood and JB Buxton from Durham Tech. Had a series of individual meetings and then group calls, and have developed this proposal for vaccine equity, which would put 45 to 50 community health workers into the field for about 5 months with our community-based organizations that have experience with this already. The council is considering this, and I expect the council to pass funding for half of this initiative very soon, next Monday. And hopefully the county will be following suit, and we'll be working with them as well. We think this is critical now to achieve vaccine equity, because we know that we got to go to people. We got to take the vaccine to people. And we think this is a really good way to do it, and to do it with trusted messengers. And so I'm excited about it. I think it can be a great step forward. I don't know if the nation is going to be able to achieve vaccine equity, and I don't know if a nation is going to be able to achieve a situation where we have reached herd immunity. But I want Durham to do that, and I know we all do, and I think we can. And so let's try to make that happen. And then finally, I want to introduce Leila Peterson. And Leila has got her camera on. You see her there on your screen. And so let me just tell you a little bit about her. I'm really excited to welcome Leila to the City of Durham employment as one of 3 Fuse Fellows who will be taking on important assignments over the coming year in the City of Durham. The Fuse Fellows program places individuals with significant experience in the private sector or the nonprofit sector into year-long fellowships in local government. And our city manager has assigned one of our Fuse Fellows to carrying forward some of the work that we've done together in the task force after our meeting today, with a special focus on identifying and advancing strategies to support our ongoing economic recovery. Our small businesses, our job growth, our job creation, all of those things. And Leila comes to us most recently from the North Carolina Justice Center, where she served as a policy analyst. And Leila, I just want to say we feel really fortunate to have you with us, and really grateful that you'll be working with a lot of the people in this group to carry on the work. And so thank you so much for being here. I'll also say that you may have seen on social media that because we have the Fuse Fellows, I got to hang out for an hour and a half with John Legend. And so that was pretty cool. Lois, you're our resident musician, so you know how cool that was. And it was quite amazing because he was so interested in what we were doing in terms of so many things in Durham, how we were fighting the pandemic, how we were dealing with the whole gamut of racial justice issues, and especially in community safety. And so that was pretty cool. But he's a big supporter of the Fuse Fellows program, and that's the reason that I got to meet him. And Leila is here as part of that. So I'm sorry my remarks were probably overlong this morning, Maticia, but I really do appreciate so much everybody, all the wonderful work that you all have done. And I don't think that Chair Howerton is here yet, so I'll pass it back to you, Maticia.
Thank you very much, Mayor Schewel. I appreciate all those comments, and welcome, Leila. Great to have you. And I also just want to welcome back Ryan. He turned his camera off, but Ryan has a new, I think, task force member inductee that he had on his shoulder a few minutes ago. But so glad to have Ryan back with us. And, I think about the past year and the tremendous support that Ryan has provided to Katie and myself, as well as the task force. So very appreciative of that, and very appreciative of Amber stepping in when Ryan went out to provide us just continued great support. So many thanks to Amber as well. So I don't see Chair Howerton. Vice Chair Jacobs, any comments that you want to share before we move on?
Thank you, Maticia. I just want to very briefly echo, I think the mayor really said it all, and just want to express my gratitude to both you, Katie, and Maticia as the leaders of the task force, also to Rod for being really the guiding light in our community throughout this pandemic, and just every single person. When I look at everyone's faces, I just see the strength of our community. Every single person who I'm looking at, who's maybe I don't see their face right now, but the just what Durham is all about. The amazing people that we have, the talents, the perspectives that everybody brings to everything that we've talked about. I think back about the past year in the beginning when we were meeting every single week. And frankly, how I looked forward to these meetings, because we were all trying to figure this stuff out. We didn't know what was happening. We didn't know what to do. And it was really all, our community coming together and listening to each other, that we found a way through. And I'm just so proud of all of the efforts that came out of this, like Back on the Bull, the way people like Duke Center for Advanced Hindsight, McKinney, just how many resources, Blue Cross Blue Shield, there were just everybody, institutions, businesses, business owners, Duke, everybody just pulling together in one direction, and how we've made our way through. So I'm just very proud of this work, and I think it will have a lasting impact on our community, the relationships that have developed, thinking about the religious roundtable and, for instance, and hopefully these connections that have been made will strengthen and build a foundation for our recovery and renewal, because that's really what this is all about, right? Recovery and renewal. And so we have that challenge in front of us now with the funds that are coming into our community, the federal funds. We have an incredible opportunity to really act on, I think, some of the insights that we've gained, the structural systemic disparities that have been, very transparent through the pandemic. And I think we can't lose sight from the fact that some people, we all talk about the K, that some people have done fine during the pandemic. Nobody's done fine in every way, but, we've all been touched by it, and we've all had losses, and it's been very stressful. But there are people in our community that have really, that are still really suffering. And I don't want us to lose sight because they don't show up in the numbers. I know CC really, with the workers' town hall, really focused on that. And so we have a real, I'm very hopeful that we will, as the mayor has challenged us, to make sure that we do get shots in every arm, and that we use what we've learned and the resources coming in our community to make real change. So again, thank you to everyone. I'm going to miss not seeing everybody, at least virtually, and maybe someday soon we're going to be able to have the party or the celebration that we've talked about. So I am counting on Maticia and Katie and Amber, Ryan, everyone, and looking forward to that and hearing Lois sing at that time.
Awesome. Thank you so much, Vice Chair Jacobs. I'm going to kick it over to Katie to provide an update on the Education Roundtable.
Great. Well, thank you. And good morning, everyone. It is a really special day as we celebrate 365 days of our 100-day task force. What an incredible group. And this has truly been just such a great privilege to be able to serve with all of you. So really, really proud of the work that this task force has accomplished. Let me give just a brief update on the Education Roundtable. We met about a week ago, and once again, that roundtable always leaves me feeling so inspired and encouraged about our futures, because those students are so engaged and just they really are the hope for our future. So really the focus this month was around return to campus planning. So already moving beyond graduations and thinking about all of the plans for being able to be back in person in the fall. And really a tremendous amount of effort going into thinking through how to do that safely and be able to bring people back safely. Some schools are already back. So Central Park School for Children is back 50% in person. DPS was not at the roundtable last week, but certainly we know they have been back in person. One of the pieces that I really took away, so NC School of Science and Math has only had 5 cases all year, and all of those were asymptomatic. So if you think about that and the work that takes for high schoolers, those high schoolers are leading the way. They really are leading the way in terms of making sure that they have been holding each other accountable to the 3 W's all the way through. We also spent quite a bit of time talking about mental health and the challenges that are coming along with that. And I think that is the next wave of this pandemic that we are really starting to see and feel And certainly the schools echoed that. And all of the schools have programs in place, they have hotlines in place, they have support services in place, but still a lot of discussion about the recognition for continued need for those services, continued need for nurses and social workers in schools, particularly our public schools, our charter schools, and supporting the community. So, and then they also talked about the opportunity that many of these schools have to reimagine themselves and reimagine their traditions. And I loved this in terms of forward thinking. So, you know, one of the students said, we're going to be coming back to campus next year in a new way with many students who have never been on campus before. So freshmen have never been on campus before. And most of the other years have spent very little of their time actually on campus. And so this gives an opportunity for them to reimagine and rethink through traditions and create new traditions. And I thought that was really, again, as we think about how we pivot and this new normal, and I think sometimes get tired of thinking about that new normal, but they're really embracing it. And so very encouraged by what I saw and heard from that group all along, but especially in this last meeting. They want to continue to meet, but likely on a quarterly basis, and have discussed having their next meeting actually in early September, so that it is after the start of the new year, get through sort of summer break, planning for the fall, and a couple of weeks into the new school year, be able to meet and compare notes and share best practices. So happy to answer any questions. If not, I will turn it back to you, Maticia, to talk to us about our proposal update.
Thank you so much, Katie. So I sent out a note to the task force on 3 budget proposals that we are moving forward with your endorsement, because I didn't get any questions that came back. And those 3 proposals included funding for workforce development, and that proposal was $83,500. Rediscover Durham, that proposal was $250,000, and a city center proposal, which was $197,400. And I just want to say thank you to Susan for the great work that she's done, not only in these 3 proposals, but in the proposals that we've gotten in the past, as well as with these. She and her team does an excellent job putting the proposals together. The proposals are really easy to get through, and when we have questions, she immediately responds to our questions. So Susan, thank you so much for making our job easier as we went through the proposals. So Katie and I will be working with Ryan to draft a letter to both the city and the county requesting equal funding of these proposals. And once we get the green light from the city and county, we'll move these proposals forward to seek that funding. So just wanted to give you a quick update on where we were, or where we are as it relates to those 3 proposals. So I'm going to keep us moving on our agenda, and I'm going to turn it over to our esteemed team to talk about COVID-19 statistics, and that's Rod, Ibukun, Katie, and Phil.
Ms. Sims, I just want to, can I just have a moment?
Absolutely. Good morning, Chair Howerton.
Yeah, as chair of the board, I just wanted to say good morning. I ran a little late, had to get my car to the shop to be serviced. We have to do those kinds of things. But I just want to say good morning to everyone. And I'm sure Commissioner Jacobs have updated you on Durham County, and what you haven't read in the paper, I'm sure you already know. So I just want to say good morning and thank all of you for the work that you have done and to make Durham better. And I know that you will continue to work to make Durham better and the lives of people to continue to be better. So I just wanted to acknowledge you and all of the members for the work that they have done on this committee. Thank you.
Thank you, Chair Howerton, and thanks for your leadership.
Thank you.
I will move right into our metrics and maybe kick us off with just the hospital metrics. And I pulled our metrics for this month, but also wanted to go back and just share a little bit about where we've been. So last July, we were sitting at, when we met in, I think, early July, we were sitting at, between Duke University Hospital and Duke Regional Hospital, 83 COVID patients hospitalized with COVID, 27 of those in the ICU. In January, we were at 180 across the health system, across all three hospitals, 144 of those between Duke University Hospital and Duke Regional Hospital, 110 of those being active cases. We spiked up to over 200 cases, about 230 cases at one point in that late January timeframe. And I'm really pleased to be able to say that our numbers have come down. So right now, we are sitting at 59 total cases across all three hospitals. 33 of those are active cases. That is the lowest that I have seen in a very long time. 49 of those at Duke Regional and Duke University Hospital. So here in Durham, 25 active. As of yesterday, first time I've seen this in a very long time, no patients in our ICU at Duke Regional Hospital. Still had 12 in the ICU at Duke University Hospital, 6 of those active. So still seeing very sick patients, but the numbers are coming down and have stabilized. I would like to see that at 0. I think we all would like to see that to 0. And that's our goal eventually. But still very encouraging to see this where we are today. In terms of vaccinations, we continue to really focus on vaccination. I will tell you that our numbers, though, have slowed. The demand has slowed, and we talked a little bit about that switch last month when we met, and that we were anticipating that, and we have certainly seen that. So even in our mobile or pop-up clinics, we've had a couple. We had one last week where we only had 8 people. That's still 8 people who will not end up in the ICU. And so that's really important to remember, but it's much smaller numbers than when we, in the beginning of this, where we were vaccinating 200, 250 in a setting, and with a waiting list, or back when we had a waiting list of tens of thousands back in January. We no longer have a waiting list. If at Duke, we have walk-in clinics. Walk-in hours at Wheels are from 1 to 6, Monday through Friday. So we have walk-in hours available every day, Monday through Friday. And in addition to that, we have some walk-in hours at Karsh and at Duke Raleigh as well. And no waiting. If you call and make an appointment, because appointments are still available, there has not been a wait time. Some of that may shift slightly in the next week, as we are very excited about being able to vaccinate our teenagers. So the emergency use authorization came forward this week for teenagers 12 to 15. I'll let Ibukun talk about that a little bit more in just a minute. But we're thrilled, and we began vaccinating yesterday, and actually did have a significant line at Wheels because of that. And that, to me, is really encouraging. I think our teenagers, again, are going to lead the way for us, and they will encourage those who haven't been vaccinated to get vaccinated. I really am hopeful with that. And we continue to focus very much on vaccine equity. We still are not fully reflective at all of the community that we're serving, but our numbers continue to improve slowly but surely. So across all of the patients vaccinated across all of Duke Health, we're at 19% of those vaccinated are African American, 62.5% white, 6.4% Asian, and 6.3% Hispanic. I will tell you that I want to bring attention to the specific partnership that we've had at Southern High School and Wheels and with Duke and Duke Regional. When we look at those sites combined, and this is, again, a partnership with the health department, with Durham Public Schools at Southern, with the city Parks and Rec at Wheels, just tremendous partnership there. And there our numbers are better. So we're at 49% Caucasian or white, 12.54% Hispanic, 5.7% Asian, and 26.79% African Americans. So certainly that partnership has been really essential, and really so thankful to Rod and to the city and to Durham Public Schools for that partnership. We do have a family fun day or family vaccine day. I don't know whether you call it fun for vaccines, but we're going to try to make it as fun and engaging as possible. And that is at Wheels on the 22nd, which is a Saturday. So next Saturday, a week from tomorrow, from 1 to 5. And that's really aimed, again, at getting our teenagers and hopefully their parents, if their parents have, or grandparents, or neighbors, if they have not been vaccinated. It is open to all, and we'll be walking hours. So, and with that, I will turn it over to Rod. And of course, always happy to answer any questions.
Thank you so much, Katie, and good morning to everyone. And I echo all the sentiments that have been expressed so far. The protocol haven't been established. I just want to say I owe a debt of gratitude to each and every one of you, because by extension of you being on this task force, you have been an extension of public health. And we cannot thank you enough for helping us to spread the positive message about keeping yourselves safe. I'll try to be brief because I know we have a lot to discuss, but just starting off in true public health fashion with three W's and a G. That's, you know what the 3 W's are, but the G is get vaccinated. We certainly want everyone to get vaccinated. And if you are able to do it, as Katie has said, we have plenty of vaccine and plenty of slots. So we certainly hope that you will do that. From a historical perspective, last night when going over things, I kind of had to chuckle because we have certainly come a long way. On May 15th, at the first Recovery and Renewal Task Force, we just had 17 cases, active cases, I would say, and then 960 total. And then we went to June 7th, in which, you know, my staff was frantic because that was our very first triple-digit case day where we had 100 cases, 101 to be exact. Then November 11th came, and that was when we first hit the century mark. I'm sorry, when we hit the 10,000 case mark, total cases. We had 100 cases that day in November 11, 2020, and 10,007 cases total. And then, of course, January 7th will be a day that will live in infamy in Durham Public Health forever, because that was the highest total count that we had. 300 cases were received in one day, and the running total was 16,516. As far as 7-day moving averages of positive cases, May 25th, 2020, around the time when we met, 41 positive cases on a weekly basis. July 6th, 2020, 71 total positive cases. So we started inching up. And then finally, January 11th, 2021, again, 192 was the weekly average. So January was not kind to Durham County. I'm proud to report today that there are only 2 active cases in Durham County. That's it. As of right now, I'm pretty sure my staff is working on some stuff right now. But 2 active cases, 25,236 Durhamites have beat COVID. Fortunately, there were 227 deaths at present. So again, we always extend our warm thoughts, prayers with those people who have lost loved ones to COVID-19. Total 25,407. As I've said many times before, Durham is doing well. Our 7-day moving average of positive cases continues to go down. Last week it was 31. 2 weeks ago was 37. 3 weeks ago was 40. So we're seeing the effects of the vaccine. Total for the month of March thus far, 366 total cases. So we continue to look at things through an equity lens as far as the different demographics in Durham. Our Hispanic or Latinx community had that huge, terrible spike last summer, and they recovered and they stayed down. And I'm so proud of that community. 14.29% of all of our cases are affecting the Latinx, which represents 14% of our population. A Black African American community, I have expressed concern. I have been on a road campaign to our Black African American advocates, to include the Durham County Affairs of Black People, to include Durham Tri, to include the African American COVID-19 Task Force Plus, because we're seeing 58.57% of all of our cases now affecting the African American community, which only represents 37% of all our cases. So we have work to do around that, particularly when it comes to vaccine distribution. White population in Durham continues to be underrepresented, as they have been throughout the entire pandemic, at a very low percentage of 15.71%, though they represent 54% of our population. A positive lab percentage, y'all remember when the mayor and the chair were all over me about that positive lab percentage. So we were glad that we were able to get it. Just taking you down memory lane. 2.9% was what we had last week, which is a decrease of 3.4% 2 weeks ago. And then, of course, we are thankful to Duke for providing us on a weekly basis that their statistics, and they have North Carolina infections growing at 0.8%, while Durham's infections had grown at 0.9% as of last week. So we're continuing to see a downward trend. Per the CDC, which really takes all vaccine providers to include federal partnerships, to include state, private partnerships, they really have Durham at 136,143 total people fully vaccinated, which represents roughly 42.3% of our population in Durham. Again, I want to remind you, they take everything from everywhere. Of that number, over the age of 18, 134,288 individuals have been fully vaccinated, which represents 52.5% of our total population. So again, we're excited about that. We feel as if we're going in the right direction. Most proud of our seniors. They continue to do well with their vaccinations. They're over 80% vaccinated at 33,342. So we're certainly happy that our most vulnerable individuals are vaccinated early. Again, I would just say that, more work needs to be done, but we're doing well as far as vaccine equity. But for the most part, we do know that approximately 254,019 vaccinations have been performed in Durham since through May 13th. For our white population, they're at 50-50. 50% of the population has been fully vaccinated. 50% have been partially vaccinated with one dose. Our Black African American community is 28-26, 28 partially, 26 fully. Our Asian population, although they represent a very small number, they're at 50% of all of our residents have been partially vaccinated, 48% fully vaccinated. And Durham County residents have been able to be vaccinated at over 500 vaccine locations across the state of North Carolina. So there is no shortage of places where you can go to get your vaccinations. Again, our Latinx population continues to do well. They are 28% have been partially vaccinated, 20% have been fully vaccinated. At one point in time, I'm pretty sure Katie can attest, there may have been some hesitancy on their part when there were groups, but the moment that we said walk-ins, we've gotten a huge number of our Latinx residents. And big shout out to the Lat19 Coalition and them pushing vaccine messaging through their social media channels. We're so grateful for the partnership. So with that being said, we still have a long way to go, but per the statistics and the data, we're doing extremely well. As Katie has said, we too have a big event on the 22nd involving War for Life, Chapel Hill Pediatrics, Durham Public Schools, and the Durham County Department of Public Health. The 22nd is just going to be a family vaccination day in Durham. I'm going ahead and proclaiming it. There are going to be 2 DPS sites. I'm not at liberty to really release that information right now. We're still working on publication. But in addition to Wheels, there's going to be 2 additional large high schools that are going to host vaccinations. And we have the capacity right now to vaccinate 400 at each site. So that's going to be 800 slots. So we're delighted that, again, we're going to be able to vaccinate a lot of kids 12 years old and up. We too at Durham County Department of Public Health started vaccinating our 12 to 15-year-old population yesterday. It was delightful to see so many come in, and it's almost like they were dragging their parents. And they came in and we did a lot of, with permission, a lot of videos, a lot of pictures posted on social media. So we hope you check that out. But they're certainly going to lead the way, and we hope that they will invoke another positive spike in vaccinations. I truly do believe that this is going to happen, but we saw, a lot of diversity on display coming through our doors, and we're happy about it. This time I'll pass it to my great colleague, Dr. Ibukun Kalu, for additional comments.
Thank you, Rod. Good morning, everyone. And just taking a moment here just to thank you all for the work over the past year. It's been a true honor. And I've learned a lot about how much it takes a team just to move the needle. So in this case, being hopefully shot soon. So just thank you, everybody. I think the only comment I'll make will be around the vaccinations for 12 to 15-year-olds. We are in a good place. We have seen the rates go down, but we know that thankfully, over the past year, even though our children have not been impacted as much as older adults, we know that vaccines protect our kids, but also protects the community. So there have been a few questions about those that are worried about side effects. There are many people available to answer those questions. The vaccines work, they're working kids. We're not seeing any long-term concerns so far. And they're available for kids over the age of 12 and adults too. So please reach out if there are questions. I'm excited to see all the upcoming vaccine events, and I hope that will allow our kids to return to normal through the summer and into the next school year. But thank you all. I'll hand back over to, I think I saw Dr. Harewood if he wants to jump in here.
Thank you very much. I want to echo what everyone has said so far about it being an honor and privilege to be part of this group. I certainly have enjoyed it tremendously, learned a lot from all of you, and have come to value even greater the partnerships and collaborations we have in Durham. I always boast my fellow community health centers from across the state and around the country about the relationships that we have here, and that we build most of our work around partnership and collaboration. So this is taking it to another level, and I really appreciate being a vital part of what was going on with this task force. At Lincoln, I'm really proud of the fact that during the pandemic, we were able to keep our entire workforce. So we didn't have to lay off any of our staff. We were able to continue to serve our patient population. So there was little delayed care for the vulnerable populations that we serve. We're still providing about over 12,000 primary care visits a month. And even with social distancing and all that, we've been able to add, of course, testing and vaccinations. As I look at the numbers around who we've tested, I carved out by race and ethnicity, and of the Hispanics tested, our positivity rate was 38%. And I'm sharing this with you because, as you would expect, a safety net provider, our numbers will be very different than the overall numbers for Durham County. So of the Hispanics tested, 38% were positive. Of the African Americans we test over the entire duration, 14% were positive. And the whites, 10% were positive. As we look at our efforts around vaccination, which is going well, we have a clinic that's open all weekdays, and we give vaccinations. You can call, make an appointment, or walk in to our vaccination clinic. And so far, of those that we've administered vaccines to, more than 80% were either Hispanic or African American. In fact, 28% were Hispanic, 55% were African Americans. So you can see that we are doing what little we can do to help with the vaccine equity effort. So we will continue to have those clinics. You can spread the word. It's usually easy. You can walk in and be taken care of very expeditiously. So we are still willing to continue to serve those in need of vaccinations or testing. So overall, again, thanks for including us in this process. Special thanks to the mayor. You've been a real staunch supporter of Lincoln Community Health Center. I know traditionally the city does not get involved in healthcare issues, but really appreciate the fact that you've seen it important to step in and contribute to our efforts around the pandemic. Of course, the county is a key partner, always supportive of Lincoln Community Health Center. So we say thanks to the county. We're grateful for all you do to support what we try to do here. And of course, the health system, key partner. And I should add that, Rod Jenkins is on our board of directors. Commissioner Jacobs is on our board of directors. Lincoln is a community governed organization, and we're proud of the fact that we can get immediate feedback and guidance from the members of our board of directors, because most of the key organizations that are involved in healthcare are represented on our board of directors. Duke University Health System, Durham County Hospital Corporation. So thanks again for all that you do. We'll continue to do our best to provide high quality primary and preventive healthcare services to the most vulnerable in our community, especially the homeless. And I look forward to continuing to work with you in the future. Thank you.
Thank
Thank
you
you.
so much, Phil. I think there was a question that Lois had for Dr. Kalu around masks for younger children. Can you provide any guidance? And I know there's a lot out just in the last 24 hours around mask guidance. So I know that's a little bit of a moving target.
Lois, just do you want to clarify so you come off mute, or would you like me to jump in?
Oh, no, particularly around, school children as well as just public spaces. As Katie said, I know the guidance continues to change. So I just wanted to know if you want to comment at all on just the general guidance at this moment for children under 12, since they cannot be vaccinated.
Yeah, I'll make a brief comment. We saw the news yesterday. We're all working quickly to see how it would impact our local guidance. Just to reemphasize, the CDC stated that fully vaccinated people may be able to take off their mask in more settings, but continue to practice what we know is safe, which is spacing out, particularly in crowded places, washing your hands, which I hope should just not go away. And if you're unvaccinated, you should still continue to wear your mask. we do not expect that we would have an authorized vaccines for our youngest children, those less than 12, maybe until September, October of this year. But we know that the trials are going on, the kids are tolerating it, the kids have surprised us throughout the entire pandemic. And in the youngest kids, we do have to measure the dose a little bit differently. We have to make sure they can tolerate the same dose. So those trials will take a little bit longer than some of our adult trials when we just look at the older kids and we're checking for safety. With that in mind, kids are still in settings where they may be grouped together, where they may be crowded, so schools and camps. And I can't speak for our state health department. I know we will have updated guidance, but I think for the most part, people are leaning towards mask use in indoor settings where kids are still going to be crowded, but potentially in outdoor settings where they can space out. We know the risk is lower outdoors. They can take their mask off and play and learn and grow together. Specifics should come out. We have a ton of meetings today across the board just to understand how this will impact all of us. Kids are not going to be fully vaccinated until later in the year. So the more adults and older kids that get vaccinated, the better it will be for us all. And in crowded settings indoors, it may be helpful to still have masking for kids and maybe even some of us adults as well. Oh, and then last thing I'll state is, and I know this wasn't emphasized, people without functioning immune systems also still need to stay protected. In those groups, they still need to stay masked. And if you have people that may have any serious health issue, particularly with the immune system in your household, you may also need to play it safe until we see rates go down substantially across our state and even across our nation. Thank you for that question. Katie, can I hand back over to you?
Great. Thank you so much. And I think it goes without saying, you know, there is nothing wrong with wearing a mask. It's actually good to wear a mask. And so I think there's some concern that I have read just in the last few hours about as restrictions are eased and the guidance allows for us to fully vaccinated to maybe not wear a mask, those who want to continue to wear a mask should be able to do so without fear of anyone ridiculing them. So I think that's just an important thing to just mention, is that people may still choose to wear a mask, and that's okay. It has protected us not just from COVID, but it has also protected us significantly from the flu in this last season. So there are lots of good reasons. All right. I think we want to turn over now to Cece to talk about the worker survey and town hall. Oh, Vice Chair Jacobs.
I just wanted to, I didn't want this moment to pass by. One quick comment. Philip, I think you have some news. Is it okay if I make sure we don't pass that by? Is that okay with you?
Yes, that's okay with me.
I really didn't want to pass this moment without recognizing Philip, because he is retiring from Lincoln Community Health Center. And I didn't want to miss the opportunity just to publicly thank him, and for all of us to just be grateful to him for his decades of service to Lincoln Community Health Center and our whole community. And we wish you well in what comes next for you, Philip. Thank you so much.
Thank you. Thank you. It's been a real privilege to serve here at Lincoln Community Health Center. So I've been now with Lincoln 17 years as Chief Financial Officer and 11 years as Chief Executive Officer. And I've enjoyed every day that I've had to come to work here at Lincoln. It's an amazing organization. Those of you, again, who are involved on our board or otherwise know about our mission, our vision, our values, and have always been fully supportive. So that has made life much easier for me. Katie, you might still have been the chair of our board when I was promoted to CEO. So I owe you a debt of gratitude for trusting me to take over that huge responsibility here at Lincoln. Lincoln is as strong and secure as it has ever been. So Lincoln is going to be fine. We have an unusual opportunity to have had additional resources available to us. So as we go through our strategic planning process and we look to the future, the possibilities are, almost endless in terms of what we can do going forward, I think. I intend to take the time off and spend more time with my wife. My wife does international mission work. She's a Baptist minister. She travels like about 6 months out of the year, so I'll spend more time traveling and supporting her, and also spending time with my grandchildren. I have a couple out in Chandler, Arizona, and a couple of grandkids down in Jacksonville, Florida. And in addition to that, I have the good fortune of having been born in Barbados and spend my early years there. So I also carve out some time to hang out on the beaches in Barbados and think about you guys and the wonderful work you're doing here in Durham. So thanks, Commissioner Jacobs, for mentioning my upcoming retirement. My last day of work at Lincoln will be September 30th. Thank you.
Thank you, and congratulations, Phil. I believe back then you had said you were absolutely committed to a good 5 years, and I know I am grateful, and I think all of Durham is so incredibly grateful that you gave us 10 years in that role, and certainly wish you all the best.
Thank you.
All right, Cece, do you want to give us an update on the town hall, which was terrific? I think a week and a half ago, and the next steps from that.
Absolutely. Thanks, Katie. And good morning, everyone. I know it is our last meeting, and I'm really happy to have the opportunity to report back on the work that we've been doing over the past few months. And I know that, support for workers in this time is really critical as it was over a year ago. And I'm really happy to see that, Durham is really committed and has always been committed to working people, and want to just go over, our journey from our survey to our town hall and what are some of the things that we're recommending for the city and the county to be taking up in response to the pandemic and how we can best support working people in this time. So I have a little presentation. We talked about the results of the survey at the town hall. So I just wanted to bring that to you all in the task force, and you just go over some of the things that we found, and then also some of those programs that we're recommending. And I think Amber has a short presentation that I have. And I'll say while Amber is pulling that up, I just want to thank Mayor Schul and Vice Chair Jacobs for recognizing the need to have a focus on workers in this task force, and also Chair Howerton as well, and understanding that there was a void, that existed in the task force and needing to have specific work that was focused on working people within the city and the county. And I was very happy to fill in the role. I've been doing labor organizing for the past 5 years. I'm the North Carolina organizing director for the National Domestic Workers Alliance, and have been organizing across the state care workers who are caring for our elderly and disabled, as well as child care workers and house cleaners. And, have been doing a lot of that work in Durham, and actually started in Durham, and we've established some really great long-lasting structures. And I was really excited to be able to pull them in as well. And I'll, be able to talk about that. Let's see. Do you all see anything? I'm not seeing anything.
Cece, we see a screen with a beautiful flower.
Okay. Amber, are you able to pull up the slides?
Hold on one second.
Okay.
Do you
There we
see it
go.
now?
Yep, got it. Thanks. You can go to the next one. So once again, I joined a little late to the Recovery and Renewal Task Force around October of last year, and had in mind some type of project to engage workers throughout the city and the county. And with that in mind, I know the task force usually has a structure of creating these industry roundtables, and instead of recreating something new, wanted to pull in the Durham Workers' Rights Commission, which was established in 2018. And is made up of folks from different industries, workers who are leading that commission, who have really been promoting worker rights and the visibility of worker organizing in Durham. And they've been wonderful at the work that they've been doing, and wanted to bring them in to really assist and look over the survey, and make sure that we're able to reach out to as many workers as possible in this process. And with the help of Ryan, before he left, we were able to create a survey that was looking at the financial impacts and the well-being of Durham workers throughout the pandemic, workplace and health safety, and the conditions that workers were finding themselves in. And then also to start to generate some ideas and solutions for how we can best support workers at this point in the pandemic. Next slide. So about the survey and how we designed it and what we were looking for, we really wanted to target the people of Durham who lived in Durham County as well as worked in Durham County and were working as of March 1st. So outside of those parameters, we really wanted to track people who have been working up until the start of the pandemic, and then track the changes that had happened over that time, and made sure to target in on just Durham residents and people who worked inside of Durham, so we could track what was happening in workplaces inside of Durham and best support the residents within the county. It was open for a month. We opened it in late March. It went through mid-April. And then we made it a point to follow up with a town hall to, one, hear from workers, to have an open forum where workers could talk about their experiences throughout the pandemic and also what some of their ideas were, and add some of that qualitative data to our kind of hard numbers that we got from the survey. Next slide. So originally our goal was to collect 1,000 surveys, and from our efforts, we were able to generate over 3,000 surveys. And within that vast number, about 1,150 of those were actually Durham County residents. And within that 1,150, about 750 met the criteria of living and working in Durham, and then also working up until March 1st, and then also completed the survey. So again, we had a huge, distribution, and we were able to, offer the survey in Spanish and English. Although we offered it in Spanish, we had a limited response rate in Spanish. But, through our listservs and social media and direct engagement with community groups, we were able to get this survey out to as many people as we could, and made sure that it was going to a vast swath of the industries that are represented within Durham. And just a special note, because this was really a collaboration between Ryan, myself, and other Durham workers. We're not at all researchers. We are not at all experts in how to run surveys. And so there was an amount of imperfection in the process. But with that imperfection, we still think we were able to create a narrative as to what was happening. And then also to, really engage workers around, those elements that we wanted to around their well-being, workplace safety, and then to offer up, how they've been engaging with the programs that exist already, how they've been able to access that information, access those programs, and then what future or new programs they would want to see. So we were able to do that despite it not being a perfect process. Next slide. So in terms of the results for the survey, you can go to the next one, Amber. A note here for demographic wise, we understand that the survey is not representative of the breakdown of the demographics within Durham. Some groups were overrepresented, some were underrepresented. But what we were able to come up with was a survey where 57% of people identified as women, 37% identified as men, 3% non-binary or preferred to self-describe, and then the remaining percentage, folks who did not want to say. I think it's really important to note that 30% had vocational training or less than some college credits, 12% an associate's degree, 28% bachelor's, and then 30% master's. So we really got a good range of the educational experience within our respondents. And then, racially, the racial breakdown was not reflective of, the demographics within Durham, but we had white respondents overrepresented at around 60%. And Black residents, I think it was 20 over, sorry, it's really hard to see, it's really small, 22% represented. And so, there are efforts that we made to connect with groups that had different bases, different racial breakdowns of the people that they engaged with as well. And we understand that, we could have done a lot more to be more representative of Durham. And that's one of the notes and lessons that we have for the next time we do something like this. Next slide. So some of the numbers that we wanted to pull out and highlight for you all were 46.9% of respondents indicated that their employment status is worse off now as a result of COVID-19. And within that, kind of large number, there was a breakdown of 28% of respondents earning or working less than they did when the pandemic started, almost 9% furloughed, and then another 10% who are still unemployed or unable to work due to the pandemic. So you can see almost half of the respondents are still dealing with the impacts of COVID, and it's had a negative impact on their work experience. Next slide. In terms of workplace safety, 18.7% of respondents are never or only sometimes provided with PPE. And we're really happy to see that, about 72% reported they're always or often supplied with adequate PPE. So, I think the efforts of this task force, as well as the wide availability of masks and PPE have resulted in, pretty good workplace safety when it comes to, having the supplies that they need to keep themselves, healthy and guarded against the virus. But there's still that 18.7%. In terms of the difficulty that workers felt with following COVID-19 prevention measures at work, 13.9% said it was very difficult to follow those prevention measures. And that's something that is indicative of the industries that they worked in, while 65.3% say it was very easy to follow those prevention measures. So, this is a note to some of the frontline workers who are facing people every day who are engaging with the wide public on work. And we know that we still have to support them at this point in the pandemic. 21.7% felt moderately or extremely at risk of getting COVID-19 at work. And 22.3% reported feeling absolutely no risk at work. Next one. So in terms of what needs to happen and how workers have felt financially because of the pandemic, want to pull out the numbers of 24.3% having slight or no confidence at all in their ability to pay rent or mortgage this month, while 52.7% reported a high confidence in being able to do that. 35.9% having been at least 1 month behind on rent during the pandemic, and then 13.8% having been more than 3 months behind on rent. So definitely a number that is higher than we would want it to be, and one where we know that housing and rental assistance is, a key priority for how we're going to move forward. 24.1% have either slight or no confidence that their household can afford the basic necessities this month, and only 54% reported having high confidence that their household can afford basic necessities this month. So again, 24.1% and 35.9% are numbers that we want to pay attention to and make sure that we're putting the adequate funding that we need in helping workers in this regard. Next one. So in terms of support programs, we were able to talk to respondents about the visibility of programs as well as the accessibility of programs, and figure out which programs have been heard of, which ones have been used, and which ones have been the most impactful. And amongst all respondents, unemployment benefits and federal stimulus checks were the most visible. 62% reported awareness of these programs. And they were the only ones that got over 50% of awareness amongst all of our respondents. In terms of the lowest visibility, the Hope Learning Centers, which support remote learning for students who are on reduced or free lunch, only 17.6% of our respondents reported awareness of that, as well as 18.7% respondents aware of the Durham Water Hardship Fund. So these are, programs that were there, put in place for our residents, and just didn't receive as much of the recognition as some of the other programs. Amongst the respondents who reported no confidence in their ability to pay rent this month, 38.5% heard of the Housing Opportunities and Prevention of Eviction, or the HOPE program, and 20.5% had heard of the Durham Eviction Diversion Program. So, a good percentage of those folks who were of the most need for those programs had heard of those programs as well. And amongst those, 20.5% have used the HOPE program, and 7.7% have used the Durham Eviction Diversion Program. Amongst the residents who had been more than 5 months behind on rent and mortgage, 57.5% had heard of the Housing Opportunities and Prevention of Eviction Program, which is great. And 30% had heard of the Durham Eviction Diversion Program. So we see as the need gets greater, also the recognition gets greater. And we see 5% have used the Durham Eviction Diversion Program, and then 35% have used HOPE. So we are getting there, and there's always more that we can do to make sure that workers are able to access the programs that are tailored for their specific needs. So I talked about the visibility and also the utilization of those programs, and want to move forward with how we were able to really distill that information and come up with some of the recommendations for the city and the county. So within the town hall, we had a portion where we were able to collect, kind of qualitative statements from attendees and hear what are the programs that existed that they've used or they want to see more of, and new programs. And as you can see, folks talked about food, rent, tax relief, eviction programs. There was a shout out to Raise Up and the work that they've been doing, talked about housing and also assistance for childcare. And these were only some of the response. So I just wanted to give, a snapshot of, the range of where our attendees were and what they wanted to see. Next one. So in terms of our recommendations, wanted to give a couple of honorable mentions to work that's already moving. We just heard last week that the city and the county launched the Emergency Rental Assistance Program and have put a good amount of funding behind that. And that is going to be crucial to a lot of the respondents from this survey and even more Durham residents. And also the county and the school board for supporting remote learning. And we know that broadband access is a huge concern for workers in Durham. And we want to make sure that students, as they continue to school from home or remotely, that they're able to get that assistance. So we want to plus that and continue that on. We also wanted to mention living wage job fairs, and I know Susan and Discover Durham have put in a proposal for workforce recovery. And some of the suggestions within that have been having a hospitality job fair, and we definitely support that. And we want to see job fairs in the industries that have been hit hardest by COVID-19 and make sure that when we're connecting workers to employers, that we're connecting them to employers who are paying a living wage as a baseline for the criteria for a program like that. Next one. So our top priorities for funding recommendations, you can go to the next one, Amber. We definitely want to see funding put into the eviction diversion program. This has been crucial even before the COVID-19 pandemic. We know that Durham has a significant caseload of evictions, and the pandemic has only exacerbated that. So we want to make sure that there's enough support, legal help to prevent evictions and to keep people housed during the pandemic and beyond. Next slide. So the Fed Up Food Distribution Program was one of the non-city or county programs that came up a lot in the responses from our survey. And this is a political food drive that was organized by NC Raise Up, the Fight for 15, the Poor People's Campaign, and Carolina Jews for Justice. And they've been stepping in for our systems and making sure that people have had the food that they need during this time. They've been supplying folks with masks and PPE, and also connecting them to movement. And so we know that that food assistance is extremely crucial, and that the work that they've been doing has impacted thousands of residents. We want to continue to see that happen throughout the end of the year. Also, with speaking with the city workers and county workers, and then also we know that there's a lot of support from the county and the city for this as well, but we want to see hazard pay extended to city and county workers so that they are able to get that premium pay for the work that they've done and for showing up throughout the pandemic and putting on our essential services and making sure that they are safe, they are guarded, and they are well deserving of the work that they've done throughout the pandemic to keep these systems running. And as I said, there's already really great support. This is something that the UE 150, the Public Service Workers Union, has been calling for, and we want to support them in that collective call for that premium pay for all of those workers. And then lastly, we know that the American Rescue Plan has put a significant infusion within state budgets as well as city and county budgets. And in many other cities, we've seen examples of worker relief funds that have extended out to workers who were not eligible for some of the federal funding, some of the industries that have been hit hardest and that are central to the economy of the municipalities that offer them up. And we would love to see something like that in Durham. And we know that this is more a significant funding request. And so we're looking at the ARP as a good source for those funds, and really have an eye out for the industries of home care, healthcare, childcare, restaurant, food service work, and also retail work. And we want to see it extended to a variety of uses, and that it's not limited, and that workers can apply for it to access things like, support for sick time or childcare expenses or transportation or everyday needs that, they're not able to meet because of the financial impacts of the COVID-19 and due to, them not being able to access, other types of funding. And so that is, an eventual goal that we have, and we would really love to see Durham establish its own independent worker relief fund, and then also engage community groups, unions, worker organizations in order to get it to the residents with the most need and who are already doing that work. So, there is a good kind of public-private partnership with that. And we think that is extremely crucial at this point in the pandemic. And we know that there's good support for it as well. And so I will stop there. We are really enthused that we were able to do this full project. I know, it's coming on the heels of the Recovery and Renewal Task Force, but we think it is extremely important. And, moving forward, we will put that proposal in. We're waiting for some numbers from the county and city side to be able to give the final estimates for, what this might cost. But we hope that there is, a good support within the task force and within our officials to, always put workers first, put the city of Durham and the county of Durham first, and make sure that, a year into the pandemic, we're able to bounce back as we were before and even better. So I thank you all for your support of this work and for, the floor that was made for us to talk about workers very explicitly.
Thank you so much for that, Cece. Great work, great information that you were able to gather. Even if it wasn't perfect, it's perfect enough for us to take some action. So really appreciate all the great work there. I know we're running just a little bit behind, but I do want to pause a minute and see if there's any questions for Cece before we press forward. Yes, Vice Chair Jacobs.
Well, I want to thank Cece for the excellent presentation and recommendations, and I was able to attend most of the town hall, which was also really great. Cece, the survey information, I think that slide that you showed, the ones that really jumped out at me were about the very strong need still for rental assistance, and also the lack of knowledge about our existing programs was very, very concerning to me. And I just wondered if there had been any insights as to ways to really improve the visibility or getting information out to the community. How do we improve on that? Just wondering if you had any thoughts about that.
Yeah, I think from doing the survey, we have some ideas as to how folks are getting their information. And I know from the organizing work that we do, those Facebook ads are super important in terms of how people are getting their news and what they're seeing every day. And, we've run Facebook ads on Instagram, and those get a ton of traction, even, past the limits of Durham County, as we saw with the survey. So we definitely want to underscore that. And then also the participation and partnership that we've had with community groups that have been really rooted in Durham and in different, segments of the community. And I think we saw that with, the ambassadors program and, other kind of partnerships that have been enacted throughout the pandemic. And I think organizers are best equipped with getting the word out and being able to engage workers in, understanding what is available, what resources are out there for them. And so I would continue to work with some of those, deeply rooted or longstanding organizations that are rooted in different communities, different neighborhoods, and then make sure that, when the applications are opening, that there's a good, amount of time that people have to prepare for that, and that the word keeps, circulating as, the time is running out for those programs. So I think those are just two suggestions that I would have, but I definitely think a mix between the in-person and digital is going to be critical.
Thank you. That's really helpful. And our new ERAP program that just launched this week, the Emergency Rental Assistance Program, that's being jointly done by the city and the county through DSS. We're partnering, to your point, Cece, with community organizations are now going to be points of entry into that. So that's a lesson that we are learning. And I think this is a really important issue for all of us and everything that we're doing. So thank you so much again.
All righty. Well, I will keep us moving along. So again, thanks, Cece, for your great work and sharing with the task force, and looking forward to the initiatives that you bring forward for funding. And so speaking of the great work, I think our next topic is really timely because as Cece shared with us, there's things that are happening that folks are unaware of. And so we have with us now Michael Davis from Durham County and Nick Allen from United Way to share with us a new program or a new fund that recently launched called Food for Durham. So I will turn it over to Michael and Nick.
And Maticia, if I could just do a quick introduction to them, and then I'll hand it over to them, and we'll be as brief as we can be this morning. But a great transition, as you pointed out, from Ms. Croxton's presentation. As you all know, food insecurity has really been a really serious kind of background problem in Durham during the last 15 months, and will continue to be for some time. And at the county's Emergency Operations Center, we've had, since very early on in the pandemic, a small food security task force that has been tasked with working with really wide range of community partners to try to figure out how best to address food security issues and to support these organizations and the people that they work with. And so I want to just briefly introduce Michael Davis, our Strategic Initiatives Manager, does a lot of innovation work with the county and has been a key creative partner or part of this task force. And also Nick Allen, who's the Chief Program Officer at United Way of the Greater Triangle, and give them the floor to kind of present some information on, again, a tool and an approach that we hope will both address some lingering needs related to COVID, but also be of permanent use to the community as we move forward out of the pandemic. So thanks, Michael. Take it away.
Drew, thanks. And thank you all for your service. And thanks so much for carving out the time for having us come and speak with you today. My friend Nick Allen, Chief Program Officer of United Way, and I are just really, really, really pleased to announce Food for Durham. It's a community-led initiative to support Durham residents and the food pantries and food distribution organizations that serve them. And you can check it out online. It's live now as of a couple weeks ago. Food for Durham is online, unitedwaytriangle.org/Food for Durham. As Drew mentioned, in the last year, I've had the privilege to work with him and Rod through the EOC, and then more specifically with the Food Security Task Force, Donna Rewalt, Knock, and Kia Campbell, and others, again, through that COVID-19 task force. We've regularly convened food pantries and other partners over the last year, plus in COVID, and we've also surveyed them a number of times, and consistently they're letting us know that pretty clearly they need additional funds for direct food distribution, for equipment, and for other needs as they continue to serve rising numbers of residents seeking food. And we're beginning to shift the conversation from the charity work into the more sustainable food justice model too. And so I know that they're going to have needs around that way as well. And so that's the rationale behind Food for Durham. We were fortunate to be able to approach United Way last fall, and they saw how this campaign would fit really well with their existing Durham One Fund, which you all are all aware of, and their whole direction, United Way's whole direction around community-owned change initiatives. And so just a big thanks to everyone who's been involved in getting this kicked off, including Nick, Kaia Clark, and Angel Brown at United Way, Curtis Massey, who I think is on the call, and Willie Darby in the attorney's office at the county. And I want to give a special shout out to Ryan Smith and Shannon Delaney at the city, who I know y'all have worked really closely with over the last year for their belief in Food for Durham. And Shannon in particular, shout out, she helped us with big time with stakeholder engagement on this last fall and designed our logo. As I wrap up, we've heard from a lot of local food and hunger relief stakeholders to get their input on this initiative. And like I said, it's their expressed need for support that led us to approach United Way to see if they'd be willing to help us create this initiative. And it's going to be community members, and you're going to hear Nick talk about this, who will shape the direction to fully plan, implement, and continuously improve Food for Durham. 2 specific asks for you today. For those attending or viewing, 1, if you could help us please publicize Food for Durham, and 2, please consider serving on the committee or suggesting potential members to Food for Durham's core committee. Again, thanks for having us today. Thanks for the work you do in the community. And I'll go ahead and turn it over to Nick to share a little bit more.
Appreciate that, Michael. Good morning, folks. I see a few friends on my screen here, but for folks who aren't friends yet, my name is Nick Allen. I am the Chief Program Officer at the United Way of the Greater Triangle, which basically means that I work with a team that's ultimately responsible for our investments, our storytelling, and our volunteer engagement. And hopefully you'll see some of those functions show up in the work that we're going to talk about this morning. We're responsible for facilitating about $10 million annually in support of nonprofit work that's aligned with our mission to eradicate poverty and increase social mobility. And historically, we've taken a regional approach, right? We serve 4 counties: Orange, Durham, Wake, and Johnston counties. And so we look at community level data, identify issues, and then attract nonprofits who can help drive impacts in those particular focus areas. And so over the last 18 months or so, we've really leaned into the opportunity to take a more localized, proximate approach to grant making, which really puts the power in the hands of local neighborhoods, local communities, local counties, to identify and define what the true issues are, but to also control the narrative and really make decisions and control how allocations are going to be contributed to those solutions. In addition to being a Chief Program Officer, I'm also a daddy. So that's my 3-year-old in the background ready to go to daycare. So I apologize for that distraction. But as Michael mentioned, the 2 big asks here are to, 1, kind of leverage and activate your networks to spread the word about this initiative. You see some suggestions here on the screen. If there's any questions or ways that we can support through collateral or any other ideas around how we can help you share the opportunity, reach out to me. I'll put my email address in the chat box. Next slide, please. But I think even more importantly is the opportunity to really engage, really get close, and really influence and take hold of some of the power that I mentioned earlier. And that's really going to be actualized through this core committee that I think will be a representative group of stakeholders in Durham. Everybody from local nonprofits to local residents to folks who receive services through local food serving organizations. And that core committee is really going to be the ones making the decisions and really structuring the way that we can support food work and those experiencing hunger issues in Durham. And so the committee is going to pinpoint local food and hunger challenges. They're going to create a fundraising strategy, and really that's controlling the narrative, right? How do we share the word? How do we identify what the issues are? How do we genuinely communicate what the issues are? And then how do we create a structure that attracts the right types of nonprofit organizations aimed at the solutions that we feel like are going to move the needle the most? And then how do we tell the story of those impacts, right? We want community to control the narrative, to really be the face of this work, and United Way will be here to support and lend its expertise in the completion of that work. And so we really see this as a critical piece of our work moving forward, and we look forward to really figuring how this looks in Durham specifically.
Thank you so much, Nick, Michael, and Drew as well. Drew helped to get this on the agenda for the day, but certainly a worthwhile conversation, and looking forward to how we can provide support for this great initiative. Any questions of Nick or Michael before we move? Mayor Schewel?
Thank you, Maticia. Thank you all so much. And Nick, I think you all also have a baby at home. Or maybe
yeah, we got 2 of them. I'm just on the 3-year-old duty. The 8-month-old is away already. So
yeah, you're busy. And it's great to say. I just want to say that Nick is an alumni of Durham City Government. We're really proud of Nick and all the amazing things he does. You all are, thank you so much. This is great. And we've done so much to feed people. Cece talked a little bit about it earlier. We've done so much to feed people throughout the pandemic. And so how is this, the county has now a staff person who is going to be or is going to be devoted to this work. And I wondered how you all are connecting to that. And also, I was going to ask, I see Donna, how you all are, I'm sure you're in close touch with Donna and all the tremendous work that they've been doing. Is this kind of dovetailing with that effort?
Thanks, Mayor Schul, for the question, and thanks again for having us. It is our new food security coordinator is working closely with us. We're kind of in a transition now where she's attending our food task force calls on 2nd and 4th Wednesdays at 10 a.m. And also we're kind of transitioning to what does the future look like in terms of mid to long-term planning with a food plan and some structure. And but it's all very much connected. And I see Donna on the call. I don't know if she wants to add anything about Mary Oxendine and her role and how it all ties in.
Yeah, thank you. Thank you, Michael. Yeah, Mary is on board. She's been with us for a month, and she's also engaged in this. I think what we've determined, also working with our staff, is that the county has kind of a more, particularly in this particular process, a little stepped back, more advisory role, and we really want the community to lead, as Nick describes, in the decision making. So Mary will certainly serve kind of in that advisory capacity. We're also trying to also help find the community members for that committee to make those decisions. So that's another role that we're undertaking, and Mary's certainly participating in that as well. We're hoping to see, in this year, the beginnings of a comprehensive assessment and planning process around food security in Durham. The food security task force has been very valued, and this type of effort is the kind of thing that we need longer term. So it's just a great collaboration, and the food security position will be in the heart of it. And Mary is someone that you can reach out to now through the county. So I will also put her information in the chat if anyone wants to reach out to her directly.
Thank you very much.
All righty. So again, many thanks for sharing this great initiative with us. I'm going to keep us moving along because we are approaching 10 o'clock and we have 2 more agenda items. Katie and I were adamant that we're going to stay on time today, but that's okay. So next topic on the agenda is really talking about the future of some of the great initiatives that have started. And we have a list of those items. And the first item that you see there relates to the economic forum. And we've had some conversations here led by Geoff and team around economic recovery. And so Geoff, do you just want to give a brief update on where we are with the economic forum?
Sure. Thank you for the time, and I'll do my best to be brief and get us back on to schedule. You guys were very generous last month and gave us 30 or 40 minutes to kind of give you a brief overview and a rundown. We also, if you recall, brought in our partners from both the city of Durham with Andre Pettigrew, as well as Durham County with Andy Miracle, kind of chatting about what their roles have been in place as well. And recall that as we summarize all the initiatives that we've taken on from the past 16, 18 months or so regarding recovery, business recovery, and getting people back to work in various different initiatives. We also determined that, continuing a conversation where we could create a forum that would be important to kind of identify our collective issues and look ways to get collaboration and buy-in, and really to be able to create solutions about the various challenges that will continue as we work towards an equitable recovery. I'm pleased to say that we do have that first exploratory meeting is on the books for next week. We'll be kind of unpacking what we're all working on, ways to collaborate, and sort of identifying what our next steps forward are. So with that, I'll open it up to other members of our committee if there's anything you'd like to add there.
All right.
Also happy to answer questions.
Any questions for Geoff before we move? All right, so next topic is roundtables, and we know that some roundtables have agreed to continue on. So as Katie mentioned at the top of the meeting, we do know that the Education Roundtable plans to continue to meet. If I'm not mistaken, I think the Immigrant and Refugee Roundtable is planning to continue. The Vulnerable Populations Roundtable is planning to continue. Dr. Davis, I wasn't sure if the Places of Worship Roundtable was planning to continue as well. But
yes.
Okay.
Yes, we're going to be meeting just once a month, though.
Okay, great. And so our thoughts about other roundtables, and I'm sure I've missed some, but our thoughts are that the roundtables, if they would like to meet, please continue meeting. Don't stop meeting just because this is the last task force meeting. So very much encourage the roundtables to continue to meet at whatever cadence that they deem necessary. Future budget proposal process, Cece mentioned a little bit when she went through her presentation about some recommendations. And so with this being our last meeting, for any budget proposals coming out of work that's tied to work that we started as a task force, Leela and Ryan will work to vet those proposals and share those proposals with the city and county managers once they've gone through the vetting process. And from there, the proposals would be presented and shared with Mayor Schul, Chair Howerton, to determine the readiness to move those forward. So, task force members, as you think about any other proposals that you may be aware of, just keep in mind, we want to keep the proposals tied to the work of the task force. And our current plan is to keep this process open until the end of June. So Ryan and Leela will be the contacts for budget proposals as we move forward. The next item that we've listed here as it relates to the future of the task force is individual meetings. So in our last, I think it was our last task force meeting, Lois suggested trying to pull together like a lessons learned, just what we've learned from the task force, not just for ourselves, but lessons learned that can benefit other task force that may be starting up. We considered trying to do maybe a survey, and oftentimes you do a survey and you get the results back and then you want to get more information. So instead of doing a survey, Leela is actually going to schedule meetings with everyone on the task force, about 30 minutes. So hopefully you'll make yourselves available for a 30-minute meeting with Leela, because she's going to work to really gather lessons learned that she can then summarize and share with the task force and have it and create an artifact that we can share with other bodies that may be starting up. So just want to make you aware of that. And I think Leela's going to start working on scheduling those meetings over the next week or so. So please be on the lookout. Next item is summer celebration. So we certainly want to pull all of us together, not in a Zoom meeting, but in some type of celebration this summer that gives us an opportunity to actually see each other face to face, which I think would be great. Would love for you guys to provide your thoughts or input into what that may look like. Katie and I haven't figured it out yet. So we know from working with you over the past year that you guys have some great ideas, but we definitely want to pull together the task force sometime later this summer for celebration, to celebrate all the great work that you've done. Katie, anything to add?
No, I think that's it. We really do want to be able to celebrate. And, we had talked many months ago, back in the fall, actually, about could we get together and try to model how to safely have an in-person meeting. And then December and January hit with our real spike in cases. And so we were never able to do that. So we really want to use this opportunity to celebrate, to thank all of you, and to be able to model how we can meet together in person safely. So we'll be looking. I know, Susan, you had some great ideas back then. We'll be reaching out to you. And if anyone has a suggestion for a venue or wants to volunteer a venue, we would love your insights. So please reach out to either Maticia or me offline. And really looking forward to getting to see everyone in person sometime this summer.
Awesome. Let's see, what else do we have here? So task force recognition at city council meeting, and that will be on Monday, May 17th. I hope I got the date right. But Mayor Schul, I don't know if you want to add a few words about that. But we got, and Amber reached out and said that I guess city council would like to recognize the task force. So Mayor Schul.
Yes, we'd love for any of you all who can attend to do so. 7 o'clock on Monday. You can go to the city website and find out information about the meeting. We are just looking forward. The council very much wants to just say thank you and give you all a shout out and a round of applause. And we'll be doing that at the very beginning of the meeting. You won't have to wait through all the public hearings, but we would love to have you on Monday night if you can be there.
Thank you, Mayor Schul. And so now I'll just pause because I quickly went through the items that we had listed on the agenda. But just to ask, are there any other areas or any other topics that you want to raise as we wind down our task force meetings? Is there something that we've missed that you want to raise and or have a discussion about?
I just raised one question. Given the CDC's news yesterday about masks, we're already getting questions. I'm kind of anticipating that Governor Cooper might speak to what's expected in North Carolina and that Durham will follow suit. But I just wanted to confirm that that's what the expectation should be right now.
That's my expectation.
Okay, thank you.
And I see from Amber that Governor Cooper is speaking at 1:30 today.
Mm-hmm.
So we should have updates after that, perhaps.
I do have I will say that I'm not sure if George is still on, but we did have Mandy Cohen come and throw out the first pitch at the Bulls for a home opener. And as I said to her, good job. He only bounced it once before it got to home plate. But she was happy. I've thrown out the first pitch before, it's fun. But I don't think anybody's ever had as much fun doing it as she did. She did a real happy dance out there on the mound. And she expressed to me her appreciation for all we're doing in Durham. I got to talk to her a little bit, and she was just saying what a great job she thinks Durham's done. So yeah, more appreciation from Secretary Cohen.
Thanks for sharing that. So the last item that we had on our agenda, and we've done a little bit of this already, is just to really spend some time reflecting on the great work coming out of the task force. And I'm not certain how many people were able to join a little early to see the slideshow. And Amber, if you can pull up the slideshow. But I think Shannon actually worked to pull together this great slideshow. I joined early to kind of look at all the slides that were included. And as I reflected on what I saw on those slides, I was like, wow, we have done a lot over the past year. And so it's not our plan to sit here and, read the slides to you, but just wanted to open up the floor as these slides kind of cycle here before us. Just want to open up the floor for others to share. Just, as you reflect over the past year, if there's anything that you're just very, very proud of that you've worked on that you just want to highlight, this is the opportunity to do it, because I want everyone to get an opportunity to reflect and share the great work that's happened as part of our year together. So I'm going to open up the floor for anyone just to start chatting.
So Maticia, we added a little bit of audio to the background of the slideshow. It's about 3 minutes.
Okay.
So we can, if you don't mind, we can just run that and then afterwards have some.
Yeah, that would be great. Wow.
Pretty impressive when I think about all of the work that that this team has helped lead with, so many across the city and the county supporting it. And Durham, I just couldn't be more proud. Durham is a pretty special place.
And I would say, as I reflect on the past year, I think Mayor Schul and Vice Chair Jacobs had some magic in selecting the members of this task force, because I have never worked with a group of people that were so willing to do the work. We had no weak links within the task force. So I think this made this experience all the better, because everyone so willingly came forward and worked extremely hard. Because as I think about the past year and meeting many of you for the first time, it's like everybody had a full-time job. So no one was doing this as their full-time job. So, as I think about the people, as I think about you, the work that you've done, it's been phenomenal.
Yeah, and I see Ryan's put in the chat, so many things not even captured in that slideshow because we couldn't capture it all in a few minutes. All of the roundtables and all of the, well beyond this team, all of the leaders in this community who have participated in those roundtables, the workers who participated in those roundtables, have just been invaluable. And then, Susan, with the Back on the Bull campaign, made 20 million impressions across the community in English and Spanish. 20 million. Again, just remarkable.
Yes, Vice Chair Jacobs.
Well, I just wanted to say very quickly, when I looked at the wonderful slideshow, really jumped out at me just how many, just the positive energy and the smiling faces, that even, during a crisis like this in our community, is that, everybody came together with a positive approach, positive energy, positive spirit, dealing with a very difficult situation. So I'm, again, really grateful for all of you and everybody, bringing to life ideas that came out of people through various ways, bubbling up through the roundtables and becoming reality, but executed through the amazing people in our community. Thank you.
All right, Katie, it looks like we made up time.
We did make up time. Amazing. Well, I do want to just sincerely thank everyone once again. One last plea and a reminder that we're not out of the woods yet. There's still so much work that needs to be done. We are definitely not completely out of the immediate public health crisis. I would encourage us as ambassadors and leaders to continue to remind everyone of, I love Rod's, the three W's and a G for get vaccinated, but continue to be ambassadors for that. And so that we don't let our guard down as restrictions are lifted, which is wonderful as we begin to get back to this new normal. We certainly want to continue to protect each other and protect our community, and particularly protect those most vulnerable in our community, and be thinking about the future with economic development and mental health, because that is, I think, we're just seeing the tip of the iceberg on that. So the work is going to continue in many different ways, just not with this task force, but again, just truly has been an absolute honor and privilege to be able to serve along with all of you. So thank you so very, very much.
And I echo what Katie said. Thanks so much for the great partnership. And something tells me our paths will cross again. So I'm looking forward to that. And I'm just going to say to all of my new friends, when I reach out to you, just remember me. But again, many thanks for the contributions that you've made to the task force, as well as the contributions that you will continue to make, because you guys are all great leaders in our Durham community, and I know that you will continue to make contributions. So thanks very much. All righty, with that said, I think that concludes our meeting, and for the first time, we're 4 minutes.
4 minutes ahead, we did it. Thanks, everyone. Have a great weekend.
Thanks, everybody.
Take care.